So what we want to do is define our parameters first. So if we're looking at the shoulder and we're looking for restrictions, we're going to look at protraction. And when we look at protraction, we want to be able to feel the angle of the ribs. When we do retraction, we want that medial border of the scapula coming up to the spinous processes. When we do elevation, we want to have the AC joint coming up towards the mastoid process. And when we do depression, we want the clavicle to be almost perpendicular to the ground or to the table. So then we do our combinations. So we know that if we elevate and protract, that would lengthen the latissimus. And so we want to feel the angle of the rib, and we want to see if the AC joint comes up close to where the mastoid process is. If that's restricted, we would do some tests for the latissimus dorsi. If we go through elevation and retraction, those are your lower fibers of serratus anterior. And you want to, in retraction, does the spinous process abut the medial border of the scapula? And again, how does the AC joint look in relation to the mastoid process? If we go into depression and protraction, a very common restriction, that's your levator scap. Stay tuned for that today and tomorrow because it does have some fascial and sometimes muscular investments onto the first rib. And then if we do depression and retraction, welcome to another muscle. It's your pec minor and upper fibers of serratus anterior. So those are the different borders that you have, and then you can learn to stretch the muscles accordingly. So if we were going to go into protraction and elevation, and then we want to stretch out the latissimus dorsi, we would have the hand over the head. We would get into this position, and sometimes you put a towel or pillow underneath. And you would make sure you had that components of elevation protraction, and then you can have him reach up over his head and relax, and we can do a stretch. And adding this bottom part here, patients really like that as well. So you can get some specific retraining there. For levator scap, when we're looking at that depression and protraction, we find that inferior angle, and you depress and protract, and you push down. And again, you're going to have that. Basically, you're pushing this down, which is going to bring that other part of the scapula up. So go ahead and push up into my hand and relax. Good. Go that way. When we're looking at those upper fibers of the serratus where you have that depression and retraction, you can actually fix the scapula here and elevate the shoulder till you feel the restriction. So see how my hand is wound around here, and then we can have him protract into me and relax. And I can do some stretching here. If you don't want to use your thumbs, you can get into that position there. Good. So I'll show you pec minor in sitting. I'll take a pillow and roll it up in between to their back. I'll take a towel, put it vertically. I'll find the coracoid process. I'll have them elevate and retract and then relax. And then I'll take my hands and I'll just do this. I'll get a mobilization of the thoracic spine. And mostly the patient feels a good stretch.